Hello, my dear students. Welcome to the subject of pedodontics. So, as you come into the subject of pedodontics, you are going to learn so much about the fact that children are not just miniature adults. You might think that extraction in adults is equivalent to extraction in children, and root canal in adults is equivalent to root canal in children, just that the morphology is super small, but the procedure is almost the same. But this myth is going to break when you read this topic, when you read this subject in detail from now on. So, when I begin with the lectures of pedodontics, I always prefer to pick this particular topic, that is child psychology, in the beginning. Okay, so a lot of you all might think, why pick up such a dry topic in the beginning of the subject, or such a complicated topic in the beginning of the subject? Because I know when you would have read about the theories, that you would have found nothing relatable. You would have found it difficult to learn so much by heart, so much. But trust me, this is going to turn up to be your most favorite topic. Every theory is going to be crystal clear after this lecture. You're going to relate to the theories of child psychology with the behavior management and with your patients, and you're going to absolutely love this particular topic. Okay, so I am Dr. Anaya Kulkarni, your guru for the subject of pedodontics, and I am going to begin with the topic child psychology for you. So, as I begin with this particular topic, I am going to cover it under the following contents. So, we'll read about a little introduction, we'll read about the history of child psychology, a few important definitions we'll go through. Then we'll read why exactly it is even important to read about child psychology. We are dentists, right? What we should be concerned about is just the dental treatment. Why do we want to read about psychology of children? What were the early and the late perspectives of psychology? And at last, the most important part of this topic, that is the theories of child psychology. All right. So stay with me and you are going to love it. Okay. So to begin with, what exactly is psychological development? So psychological development, as you all, the first thing that comes to your mind is the mental development. Okay. So you equate psychological. So you equate the psychological development with what? Just the general mental development, right? So basically, the psychological development is a dynamic process which begins at the birth. Okay, so the psychological development, as you all might think, does not develop when the child grows up. It begins at the moment a child comes into this world, at the time of its birth, and proceeds in an ascending order through a series of sequential stages manifesting in various characteristic behavior. These stages are governed by genetic, familial, cultural, interpersonal, and interpsychic factors. That means the type of psychological character a particular person carries, it does not come out of magic key, abracadabra, and this is going to be your psychology. No, it keeps on changing, or it is actually governed by genetics. You say, right, ki she is like her father or she's like her mother. So it is predominantly governed by genetics, by the family. It is familial governed. Again, cultural, so what culture the child grows into. Interpersonal, like what type of relations that person has with the others. And interpsychic, the mental relations of that person with the others. So a person's psychological development is not his own. Matlab, there are unique features to everybody's psychology, but there are features that are actually governed by a lot of factors also that I just mentioned, right? A better understanding of child psychological development helps to understand the child better. So how does the child psychological development helps us understanding of it? So it will basically help you to understand the child better. You need to understand the child better, or and to deal with him more effectively. And second, to detect deviations. Okay, it will also help you to detect deviations. Right. So you are a doctor, right? You cannot be like, I am a dentist and I just have to think about the teeth. There are caries, I am going to do an extraction, I am going to do a root canal, I am going to do a filling, whatever. I am just going to look at the tooth. Doesn't work that way. You are responsible for for a lot of things as a doctor. Okay, so you must know what a normal human is like, what is the normal behavior of a human is like, what are the normal activities are like, so that you can detect deviations from the regular patterns. Right, so when you know that this is something else, array, this should be like that, but this is like that. So when you know that this is a deviation from the regular pattern, you know how to change your technique of treatment, or how to deal with the patient in a different way. So that is why you must know about the psychology of the patient. Okay. So now when we read about the psychology, we must know about the heroes of this particular subject, like who actually brought up the psychology into your into your world of dentistry, right? So to begin with, so this is basically the history part that I'm covering now. So in 1879, my God, so early. In 1879, Wilhelm Wundt, the father of scientific psychology, opened the first laboratory for psychology. Who was he? He was Mr. Wilhelm Wundt. Okay. So before this, I'll tell you. So before this, what used to happen? There was nothing like psychology. There was nothing like deviation from psychology. Whoever acted in a little different way was supposed to be crazy, okay, and was sent to temples or churches or places where they were believed to have, acquired some demon in them, and they were left on to, or they were sent off to these places where the demon was supposed to be brought out of them. Eventually, by the year 1879, this person, who was also known as the father of scientific psychology, said that deviation from the normal does not mean possessing a demonic entity. It means that the patient, or that the person, has something off or has something different in the psychology, and that needs to be investigated and treated in a scientific manner, and not sent off to temples and churches. So this fellow was called as the father of scientific psychology. All right. And he opened the first laboratory of psychology, and then onwards, psychology developed as an individual science altogether. Okay. But who is the real hero is Sir Sigmund Freud, who is the founder of modern psychiatry. Okay. So eventually, in the 20th century, Sir Sigmund Freud came. Sigmund Freud. Sigmund Freud was, came into the world of psychology, and his contributions made him to be called as the founder of modern psychiatry. Okay, so you must remember who was the founder of modern psychiatry. He was Sir Sigmund Freud, the founder of modern psychiatry. Right? Let us now very quickly brush through a couple of important definitions. So, what is psychology? It is a scientific study of the human mind and its function. It is a scientific study of the human mind and its function, especially those affecting behavior in the given content context. Okay, so it is the study of human mind and its function, how it functions, especially especially the function that affects the behavior, that is psychology. What is child psychology? So child psychology is the science or study of a child's mind and how it functions, that is called as child psychology. It is also the science that deals with mental power and an interaction between the conscious and subconscious elements in a child. So, to be precise, what is child psychology? It is basically the science or study of child's mind and how it functions. All right, so we are going to read in detail about child psychology. Okay, so whenever we read about child psychology, we read about behavior, fear, and cry. In the behavior, we read about basically the negative behaviors. Okay, so these negative behaviors are fear, cry, anxiety, anger, etc. The positive behavior are the good behaviors. So we need to deal with the negativity of the behavior, and there is no dealing with the positive is positive, it will support your treatment. Okay, so we need to deal with the negative side of the behavior in order to make it positive, consciously make it positive, so that it helps in our treatment procedure. Okay, so about this behavior, let us first understand what is fear. So when we read about fear, okay, so fear is what, according to Dorland, an unpleasant emotional state consisting of psychological and psychophysiological responses to a real external threat or danger, including agitation, alertness, tension, and mobilization of the alarm reaction, is called as fear. Okay, so it is the unpleasant emotional state consisting of consisting of psychological and psycho psychological and psychophysiological. That means psychological means something related to the mind, the brain. Psychophysiological means where there is connection between between the mind and the body. Okay, the reaction that occurs due because of the interaction of the mind and the body. Psychophysiological responses to a real external threat or danger, including, basically this is called as fear, which includes danger, is called fear. It includes agitation, alertness, tension, and mobilization of the alarm reaction. Okay, so basically this is fear. So fear is what? It is an unpleasant emotional state. It is an unpleasant emotional state, right? It consists of the psychological and psychophysiological response, like about a particular, like for example, you have walked into a very scary dark room and you see something white fluttering in the corner. So what will you experience? You will experience an unpleasant emotional state, right? You will, what you feel is not you are not feeling, will you feel happy in such a state? No, you will feel something very unpleasant. It will be an unpleasant emotional state consisting of psychological. So you will start thinking like, oh my god, is it a ghost? So is it going to harm me? So that's a psychological and a psychophysiological. And while you're thinking that it will come and harm you, or probably you will get possessed or something like that, there is going to be a physiological response to that psychological state. You'll probably start sweating or shivering. That is psychophysiological response to the external threat or danger. That fluttering of the white thing, which is like an external threat or danger, it will include agitation. You will be agitated, you will be very alert, that is it coming towards me, is it coming towards me? So you're going to be alert. There's going to be a tension and mobilization of the alarm reaction. Mobilization of the alarm reaction, as in, just imagine that fluttering of the white thing is happening and suddenly it flutters very fast, or probably it flutters and comes towards you. So you will run at the, with the greatest energy that you have. That's mobilization of the alarm reaction, है ना? That actually is fear. That's the greatest, that's the height of the fear that you can go. Okay, so when we read about fear, it's not always that much of fear. The types of fears vary, the reason of fear varies, and with the reason, the reaction to the fear varies. So for the same thing, we need to read about the classification of fear. So what is the classification of fear? Let us go through classification. Okay, so we're going to read about the classification of fear. So, fear can be of three types. Okay, it can be innate fear, it can be objective fear, and it can be a subjective fear. Okay, now subjective fear again can be classified into three types of fear. What are those? So, subjective fears can be suggestive, okay, it can be imitative, and it can be imaginative. So, this is the basic classification of fear. Now, let us understand one by one what do these different types of fear actually mean. So, when I say innate fear, innate means something that comes from within. Okay, so innate you can remember like something that coming from inside. Okay, that means something that is present by birth. Okay, so that means for this type of fear you do not need a previous experience. Okay, it's just present within you from birth. For example, the fear of loud noise. Do you need to teach a baby that you have to be scared of loud noise? No, whenever there is a loud noise, the baby will get startled, the baby will be scared, the baby will probably start crying. So the fear of loud noise, the fear of dark places, है ना? If you take a little child in a dark place, he will get very irritated. He will not. He will feel scared. So such types of fears do not need any previous experience. These fears are present since birth. They are present from within. It depends on the vulnerability of the individual. How much. What is the degree of fear? But these fears are generally always present. So these are called as innate fear. Okay, that is the fears that are present by birth. Second type of fear are the objective fear. What is objective fear? Objective fears are the fears that are produced by direct stimulation of sense organs, that is something that has a previous experience. Okay, for example, so something that is related to sense organs, that is something that you would have felt, seen, or smelt, etc. I'll give you a couple of examples. For example, a small baby does not know that this particular utensil is hot. Okay, he wants to touch that utensil which is very, very hot. You keep on saying, don't touch it, it is hot, don't touch it, it is hot, you will burn your hands. But no, the child is very curious and now he wants to touch that utensil. The moment you turn somewhere, or the moment you stop paying attention for a few seconds, the child runs to that hot utensil and catches hold of that utensil. The hand gets burned, है ना? So this is the touch that he has experienced. He cries, he is he goes crazy because of the pain, but now he is scared of every utensil that is kept near the burner. Okay, now he understands that there is something that is called as a hot utensil and you just cannot be around that utensil. For example, okay, second example is like, if a child due to his health problems was required to be repeatedly hospitalized, so the green curtains of the hospitals, the smell of the sanitizer, the smell of the spirit, etc., these also develop a kind of fear. Okay, these are called as objective fears because they develop from a previous unpleasant experience. Okay, so these are developed from past experience. Okay, so when somebody comes in direct stimulation, or when somebody has direct stimulation of sense organs. Okay, direct stimulation of sense organs. The next is subjective fear. So, subjective fear is something again that does not have a previous experience, does not have a past experience, but the feelings that are the fear that is based on the feeling and attitude suggested to the child by the others, such as the family, peer, media, etc. So, whenever a child is given a particular idea through the others, it develops into a subjective fear. I will tell you based on the examples of the three types of subjective fear. The first is suggestive fear. Okay, so the fear acquired by the suggestion of others. For example, you will see mothers generally say, if you eat a lot of chocolates, if you eat a lot of sweets, I will take you to the dentist and the dentist is going to give you a good injection. Okay, so now the child is scared of the dentist because all he knows is he has been suggested that a dentist is known for giving injections. So he does not have any past experience, but because of that repeated suggestion by the parents, he has developed a fear that if he is taken to the dentist for anything, he is going to give an injection to him or her. That is suggestive fear. Second is imitative fear. So, what is imitative fear? It is transmitted while displayed by others, acquired by the child without being aware of it. Okay, so imitative is something that is acquired by just observing others, and he does not even know that he's scared of it now. For example, you would have, all of y'all would have gone to an amusement park. You go to an amusement park and there is a huge slide over there. The various rides are there, no, in amusement parks. So you go to one of those, you're standing in front of that ride and you think, should I go over this ride or not? And then you see there are a few people who are sitting on the ride, and as soon as the ride is coming down or going up, they are screaming like crazy. Okay, they are just screaming. Okay, and then you're like, my god, these guys are so scared, I think I should not go, it is a very scary ride. Okay, so he does not even know that he has acquired the fear from others. right? By looking at others. Like, for example, a lot of times in our clinical operatory, it will happen, like if a child who is sitting on the dental chair, he starts crying or shouting during a procedure, the children who are sitting in the waiting area get scared. My god, what is this dentistry about? I think there's a lot of pain associated with it, that child is shouting so much. So even nobody has directly suggested anything to that child, he does not have any past experience, but just by the display, just by hearing somebody else, he has acquired that fear. That is imitative fear. And then the third, we have imaginative fear. So as a child, the imagination capabilities develop, they start imagining the worst. Okay, as the child grows up, their capacity to imagine, their capabilities develop, they start imagining the worst of what can happen. Okay, so that is imaginative fear. Like, for example, if he's gone on an amusement park in a ride, he'll think, my god, what if it breaks, what if I fall down, what if I break a leg? So these are all imaginative fears. Nobody to imitate, nobody to suggest, but just the imagination that is going wild. That is imaginative fear. Okay, so always remember, in innate fear there is no past experience. In objective fear, there is past experience. And in subjective fear, again, there is no past experience of the particular type of fear, or the particular type of situation. Right? So, this is the classification of fear. Let us now come down to the next classification, that is cry. Next, next type of emotion, that is cry. All right. So, the most common way a child expresses fear is by crying at a dental office. That's the most common way of expressing fear. How does a child express that he is scared of whatever is in your hand, that he is scared that what you're going to do? He will start crying. Okay. Crying is an expression of personality of an individual. Okay, crying is an expression of personality of an individual, right? So, what are the various types of cry? So, let me show it to you in a very beautiful diagram. There you go. Okay, so various types of cry are these, and you can see beautiful pictures of babies crying there, right? Okay, so the four types of cry are the obstinate cry, we have the frightened cry, there is a hurt cry, and then there is a compensatory cry. There are these four types of cries. Okay, can you all see how what are the different beautiful expressions of the babies? So let us one by one understand what is the meaning of these various cries. The first is obstinate. First is obstinate cry. So whenever we read about the obstinate cry, there are a particular set of words that you should remember. In the question also, you will be given these words, and they will ask you to choose what type of cry they are talking about. So obstinate cry is loud, it is high pitched, it is where a child throws temper tantrums. Okay, so these are the three characteristics of an obstinate cry. So the cry is very loud, it is high pitched, and throws temper tantrums. That means where the child is acting very stubborn. What is temper tantrums? Where the child is stubborn. He's throwing his hands in the air, he's stomping his feet. That is throwing temper tantrums. In Hindi, we call it zid karna. Okay, so a child throwing temper tantrums. Temper, this is temper. Okay, so you will be given questions like, which is a cry that is high pitched and is associated with the child throwing temper tantrums? So it is an obstinate cry. The second type of cry is frightened cry. So the obstinate cry can be even before the starting of the treatment also, because he's just throwing temper tantrums. He does not want to get the treatment done. He just thinks that if I throw temper tantrums, if I irritate them, they might not take me up for the treatment only. Okay, so that's obstinate cry. Then we have the frightened cry. So this is accompanied by a torrent of tears. Okay, it is accompanied by a torrent of tears. Okay, there are convulsive breath catching sobs that are associated with it. Okay, so in this particular case, the child is very scared of the treatment, what you are going to do, and there is torrent of tears. That means there are a lot of tears, and convulsive breath catching sobs are something like this. Like this, the child will cry. That is called as convulsive breath catching sobs. These are called as frightened cry. Then we have the hurt cry. So hurt cry is louder, more frequent. So hurt is when the child actually has pain. That is when he lets out a hurt cry. So until now, obstinate is just when he does not want to get things done. So he's throwing temper tantrums, he's acting stubborn. Frightened is when he's scared of what is going to happen. Okay, but hurt is when the child is actually hurt, he's actually in pain. So such a cry is characterized by such a cry is louder and more frequent. So such a cry is louder and more frequent, and it is accompanied by a whimper. Whimper, that means the type of cry when you're hurt, right? There's a painful voice that you let out when you are hurt or you are in pain. That's called as a whimper. So it is accompanied by whimper. Right. And then the last type of cry is the compensatory cry. I think the favorite of the MCQ paper setters. There are a lot of times when you will get this question: what is compensatory type of cry? Or say they will give you a characteristic, a characteristic, and they will give you four options like which type of cry it is. So a compensatory cry is not a cry at all. The first feature is it is not a cry at all. The child just goes on, like that. A monotone he will let out. Okay, there will be a monotone, a tone that is just in the same pitch. You are not even doing anything. The child is lying down on the chair. You're probably mixing the cement, or you're doing something else, and he'll be like that. A monotone he's gonna go let out. So that's called a compensatory cry, because he wants the surrounding frightening sounds to drain off in his own sound. That is why he's trying to compensate the surrounding sounds. That's called as a compensatory cry. So it is not a cry, it is a slow sound. It is a slow sound, and it is a monotone. So it is a slow sound, right? This cry is a slow monotone. That's it. So these are the four types of cry that you're supposed to read, and you get MCQs related to this. Okay, now basically let us very quickly understand why do we need to read about child psychology. So we need to read about child psychology mainly to understand the behavior problems psychologically, right? So why exactly that also? See, As I told you, the various treatments that can be done in a child look like they are exactly the same way as they are done in the adults. So you do an access opening, you do the BMP, you do an obturation, you do it exactly in the same way in the children also. You do access opening, you do BMP, you do obturation. But where is it challenging? It is challenging because, like, an adult will sit on the chair and get it done, the child will not sit so nicely. He's going to give you a tough time in the behavior management. You might not be able to deal with him if you do not understand what he is thinking psychologically. What is the type of psychology the child has? So, to do an appropriate behavior management so that you can do a treatment, you have to understand the psychology of the child, and for the same you need to understand about the child psychology. Okay, so you need to deliver dental services in a meaningful and effective way, establish effective communication and gain the confidence of the child and the parent, produce a comfortable environment for the dental team to work on the patient, teach the parent and the child the importance of primary and preventive health care. So all of these things, if you all have to do, you need to understand the basic psychology of the child. Again, the psychology varies from different ages. A psychology of a 2-year old will be very different as compared to an 8-year old. So you need to understand the variations of the psychology of children. Okay, that is why you need to read about child psychology. Clear? Now, to understand the psychology, we are going to again read about three definitions, that is behavior, behavior management, and behavior guidance. So, what is behavior? It is any change observed in the functioning of the organism. Okay. So, any change observed in the functioning of organism is the transitioning behavior. It is called as the behavior. What is behavior management? So, behavior management is the means by which dental health the means by which dental health team effectively and efficiently performs treatment for a child and simultaneously instills a positive dental attitude in the child. That means management, behavior management is what? It is the procedure by which the team, the dental health team, will effectively and efficiently perform the treatment for the child, along with along with instilling a positive dental attitude in the child. So the dental attitude of the child has to be made positive. The child should feel positive about the dental treatment. Okay, that is called as the behavior management. Again, there is one more term that is called as behavior guidance. So, management means to manage the existing behavior and try to instill a positive attitude in the child regarding the dental treatment. What is guidance? So, it is a continuum of interaction involving the dentist, the dental team, Okay. The patient and the parent directed towards communication and education. Okay, so this is the continuum of interaction. That means this does not end, the behavior guidance does not end in a single sitting. It is like the guidance, like how you guide the behavior. You first instill a positive attitude in the child.